Hi, everybody. Thanks for coming. I'm Gina in the alumni office, and I also wanted to introduce Eileen Patron, who is our Associate VP for HR. And we're really happy to invite back Jim Holtzman. Jim did this seminar for us last year for alumni. Eileen happened to be in the audience and thought that this might be a good event for our employees as well. Jim is a 1996 graduate of La Roche. You correct me if I say wrong. He's also a member of the alumni board. He's a shareholder and partner at Legends Financial. Let me say that again. He's a wealth advisor and shareholder at Legends Financial Advisors, which is located right down the street. He also has gotten he has a lot of awards. In fact, if you came to our office and looked at the Jim Holtzman file, it's one of the thicker files. But most recently, Jim was selected as one of the Pittsburgh area's 2016 5-star wealth managers, published by the July issue of the Pittsburgh Magazine. Jim was selected by the Dental Products Report magazine as one of the best financial advisors for dentists in America. And this is the 5th time that he's been named for that, given that honor. In March, he was selected by the Medical Economics magazine as one of the best financial advisors for doctors in America. And this was his 8th consecutive time that he was chosen for that award. And lastly, Jim was inducted into our La Roche College Distinguished Alumni in 2014. So it is truly my pleasure to welcome back Jim. Thank you. I'll turn it over to you.
So what I'll try to do is keep my presentation about maybe 30 to 35 minutes. Please feel free to interrupt me at any point to ask questions or afterwards, whatever works for you. And what we're also going to try to do is the slides that I'm going to go over, we're going to try to put them onto the La Roche website, so that way you'll be able to access them at any point and go through anything you want from there. So that way you don't worry as much about taking notes or whatever works for you, you'll have access to the slides one way or the other. Okay, so what we're going to talk about today, we're going to talk about Medicare, what Medicare is. We're going to talk about the enrollment process. That's probably where I get a lot of questions from our clients, is what does all this mean? What dates do I have to use to actually enroll into Medicare? And how exactly do you go through the process? So I think it's like anything else, it's a really confusing area, so you have to really take some time and get your hands around what in the world do I have to do from day one. So we'll also cover how much Medicare costs, what does Medicare cover, what does it not cover, what kind of gaps do you have? Do you have to consider whether or not you want to fill those in with some kind of other insurance coverage? Now, as far as planning for the cost of healthcare, which has gone up exponentially over the last 10, 15 years especially, and doesn't really show much signs of abating at this point, we're going to talk a little bit about how it impacts your overall picture and what you should be thinking about for retirement and how much you should be thinking about in terms of what your overall healthcare costs will be. Because the problem is, you can see right on the very last point, Medicare does not cover long-term care. So it's a big issue, and you have to at least have a plan in place for that. Let's talk about the enrollment process. So the first thing is, who actually pays for healthcare? So on the left side, we've got before age 65. So if you're on an employer plan, you're going to have that coverage. And then you might also have retiree health insurance. And then you have COBRA. And then you have individual health insurance policies. And COBRA is whenever you leave an employer, you'll have an option to continue that policy for 18 months, and then you have to bear the full cost of it. So that's what COBRA really is about. Then after age 65, you got Medicare will step into the picture. Now there's one big exception, and I'll mention this a number of times throughout the presentation, except for employer group plans that cover 20 or more employees if you or your spouse is still working. So what am I talking about with that? If you're working for an employer that has 20 or more people at that employer, you don't have to enroll into Medicare at age 65. It's one of the most popular exceptions, if you will, to the enrollment process. So that's a really key variable. Because you might have heard with Medicare, and I'll talk about this a little bit more, if you don't enroll on time, there are penalties you'll pay on the premium. You'll pay a higher premium, and that will always be there. That will always follow you throughout the rest of your life if you don't enroll on time. So this exception is really important, because if you do work for an employer with 20 or more employees, and that's where you're getting your health coverage, you don't have to enroll for Medicare right away. So that's a really key issue. And we'll talk about when in that situation you have to as well. So what all this means. So we're going to talk again about the issue with the 20 employee program. And otherwise, you've got to enroll in Medicare at age 65. Let's jump ahead a little further. So we talk about the penalties. The other issue you need to keep in mind is that your health care expenses may not be covered by insurance. So we need to talk a little bit more about what exactly is covered and what is not. And then there's other policies we'll talk a little bit about in terms of above and beyond Medicare and how that will operate, how that will be coordinated. So now Medicare, one thing that's always kind of interesting is, I'll get this question from my clients a lot, is it's actually administered by a group called the Centers for Medicare and Medicaid Services. It's not actually Medicare technically that's actually administering it. That's actually the group that runs it. And you enroll through the Social Security Administration. So just to make that part even a little more confusing, it's not like you enroll through Medicare. You're actually going to go through the Social Security Administration to actually get this completed. Now, who's actually going to be eligible for Medicare? So it's going to be everybody over the age of 65. And then there are some situations for people under 65 that are going to be eligible for Social Security disability benefits, also have the ability to enroll for Medicare. But that's it. Pretty much it's going to be age 65 is the first point where you can do this. Now this is an important slide, the 4 parts of Medicare, as I'll call it. And I have another slide that'll break this down even better. So you have Part A, which is for hospital insurance. You have Part B, which is for medical insurance. Then you have what's called Part C, and that's a Medicare Advantage plan. And then you have Part D, which is Medicare prescription drug coverage. Now let me go to another slide. I know it's going to be a little bit hard to read, but this is one of the most important pages for you to understand as you're going into this process. So what happens at age 65, you have a couple of routes you can go as far as Medicare goes. You can do this, which is called Original Medicare, that's Part A and Part B. And then from there, you have the option to go into Part D for prescription drug coverage. That's relatively new to the system. And then from there, you can actually go to what's called a supplemental coverage. It's called a Medigap. So what Medigap will do is it'll cover gaps of what Medicare A and B don't cover, maybe co-pays, deductibles, things like that. So that's one path you can go. Another path you can go is what's called a Medicare Advantage plan. So it's called Part C. And this will run more like health insurance like you're normally used to. You have an option for an HMO or a PPO type of a plan. What a Medicare Advantage plan does, it's basically going to cover Medicare A and B. Most of them cover Medicare Part D, and they also will cover a lot of the different gaps that can be that can catch you, like the co-pays and the co-insurance. So Medicare Advantage is one policy. You get it from a private insurance company. Highmark, UPMC have a number of different programs for this. But these are the 2 routes that you can go. So again, it's Original Medicare, A, B, D, and maybe a Medigap or supplemental policy, or a Medicare Advantage plan, where everything's kind of wrapped into one policy. So we'll talk about some of the pros and cons of this in a couple of slides. When you reach the age of 65, Medicare A and B are automatic. Now you can decline Part B if, again, you have the situation where you're working for an employer and you don't need to go to Medicare right away. The coverage will start the first of the month you turn age 65, and then Part C and D, they're not automatic. So you got to go to the private insurance companies to get this coverage. So Medicare D, again, is for prescription drug coverage, and then Part C is that Medicare Advantage plan. Those are not automatic. Now, if you're not receiving Social Security when you turn age 65, then you have to go to the Social Security Administration to actually go through the enrollment process. Now, there's different enrollment periods. This is a really important page, along with a couple of other slides that I have. You have what's called an initial enrollment period if you're not covered by a group plan at age 65. Now, as an example I gave before of that 20 employee employer plan. So if you're not covered by that, then you want to go through the initial enrollment period. I have another slide that kind of breaks up the time periods a little bit better. You have the special enrollment period, and that's if you are covered by that group plan, again with 20 or more employees. And then you have a general enrollment period. So if you happen to miss the initial or special enrollment period, this is another type of enrollment period, and I'll give you the dates on those. So this is a really important page to have an understanding on. So this is the situation where if you're not automatically enrolled, you have a 7-month period that you can enroll into Medicare. So the way it works, if you want to enroll in Part B, to have no delay in coverage whatsoever, you want to go 3 months, 2 months, or 1 month before you turn age 65. Then you can sign up for the month you turn age 65, but you're going to have a possible gap in coverage if you're not careful. And then you can have what's called a delayed start, which can be 1, 2, or 3 months after you turn 65. But again, you got to be careful you don't have a gap in your coverage wherever you currently are. What this does is eliminates the problem of having to deal with that penalty for not enrolling. If you're within these timeframes, you're good to go on that part. But from a more practical end, you want to make sure you still have some kind of health coverage during these timeframes. Now, who signs up for Part A during the initial enrollment process? Well, just about everybody will enroll for Part A in that situation. However, if you are working, I always recommend go to your benefits administrator and talk to them about what happens at age 65. Just have a conversation, make sure you understand how your group plan coordinates with all these different coverages. So, one other point on this would be, and it's probably not going to apply to too many people because this is still relatively new, that the only time you typically will not sign up for Part A is if you have as an employer plan that is a high deductible plan and you're using a health savings account with it. And if you have a health savings account, you can't be on Medicare Part A and contribute to it. And that's a special type of a vehicle that you can put money into that could be used to cover medical expenses in retirement. I'll leave it at that because it's a pretty confusing area, but I want to at least scrape that surface for everybody. Otherwise, you're pretty much going to get Part A at 65. Now, who signs up for Part B during that initial enrollment period? So it's going to be, again, people who are not covered by an employer plan that covers 20 or more employees. And then if they're not working, self-employed, employed by a company with less than 20 employees, if you have that COBRA coverage, if you're receiving retiree health benefits, or employed by a company whose coverage is less comprehensive than Medicare. Now, who signs up for Part D during the initial enrollment period? So Part D, again, is prescription drug coverage. So it's going to be for people who've signed up for Parts A and B, and they need to get prescription drug coverage. So there are, again, enrollment penalties that will apply for that. And then you have to take a step back on this and see how you're going to go down this road. If you're going down the route of Medicare A and B, then you're going to want to get that Part D plan. Or if you're going to go the route of the Medicare Advantage plan, that Part C program, most likely your prescription drug coverage will be wrapped into that policy. Now, the special enrollment period, we'll talk a little more about this. So again, the special enrollment period is going to be the situation where you're working for the employer, 20 or more employees, and you don't have to sign up for Medicare Part B right away. This also applies if your spouse, go to your spouse's employer coverage, it applies to the two of you. So the special enrollment period for Part B, that's any time before the coverage ends, and there's an 8-month period starting the month the group coverage ends that you can actually enroll into Medicare and not have to deal with that penalty that will follow you forever. Again though, you have a practical issue. You want to make sure you don't have a gap in coverage. So you want to try to coordinate the best you can with your employer coverage and when that is going to end. And then there's also a special enrollment period for Part D, which the only difference is you have to sign up for that within 63 days after the coverage ends with your existing employer. So what's the best time to enroll in Medicare? So if you want to, again, not deal with those late enrollment penalties, you want to sign up during that initial period or the special enrollment period. And then to avoid gaps in coverage, you got to sign up before your coverage ends. So I think a lot of people get so hung up on the penalty issue, which is very understandable. They forget, oh my gosh, I don't have coverage because of the timing of when Medicare will actually be put into place. Now, there's also a general enrollment period. So again, if you miss that initial enrollment period, you do have the ability to sign up during this general period, which runs from January 1 to March 31. And this has been this way for a number of years. However, in that case, your coverage will start on July 1. So you got to be thinking about gaps in your existing coverage. Make sure you're not exposing yourself unnecessarily. Now, as far as, again, I like to repeat a lot of the information because it's so confusing. I think the more you see it, it's better and better. So in this one, I've got the initial enrollment period set up. So again, that's for everybody age 65, not covered by an employer plan with 20 or more employees. Best time to sign up, 3 months before your 65th birthday, because of that one page I showed. That'll be the best chance of not having any gap in your existing coverage. And then the coverage starts the first of the month you turn age 65. And then the special enrollment period, again, the best time to sign up is before the coverage ends to not have any kind of a gap. And the coverage will start the first month of enrollment or the first month of enrollment following if later. Now the general enrollment period, that's going to be, again, for anybody who's missed the initial enrollment period, you want to sign up for that between January 1 and March 31 for coverage starting on July 1. So again, the Social Security Administration is where you actually go to. So ssa.gov is where you can go to apply online. You can call them. You can also set up an appointment. And a lot of times with my clients, I tell them just go to a Social Security Administration office and sit down with somebody. It's too hard whenever you're trying to sign up sometimes online because it is confusing, and it can even be even harder when you're calling in the number. A lot of times the representatives are pretty helpful there, but I can tell you, unfortunately, you call back 3 times, you might get 3 different answers. So sometimes when you actually go to the office, set up the appointment, and just go and meet with somebody, we've had really good luck with our clients going through that process. We've actually never had a problem that route. But whenever we make those phone calls, it's a little bit of luck, if you will. Yes, sir.
Where is the office?
They're all over the place. If you go to the Social Security website, they will have an office locator there.
Yeah.
I know, like in the city, there's one in East Liberty. There's one downtown. I know there's one. I don't know where the one is in the North Hills. But
65.
Is that where it is?
Yeah, near Leedsdale, I think.
Okay, that's the closest one to here?
Yeah.
Wow. So, but their website has a good kind of office locator area. You can get the best location or the closest one. I've had good luck as well at the location out of Monroeville. So I don't know why that is. Again, it's kind of luck of the draw. There's no logic behind it. But we've had a lot of really good success at the Monroeville location for whatever reason. So, yes, ma'am.
Not Lebanon.
Great. They're a really good one? Good. That's good to hear. So I will tell you, allow some time to get the appointment scheduled. They are very busy. So, I mean, don't wait till the last minute to go through this. You got to at least be thinking a couple of months ahead to get something scheduled that makes sense. But for the most part, it works really well when you just go to the office because they can pull up your records right there. I mean, they can do that when you're on the phone, but at least when you're sitting there in front of them, you get to see what they're seeing. There's not really any questions about it. It lessens the misinterpretation possibilities. So, and then I think the website actually works really well. Some of our clients have gone that route and done it and have had no problem. But I just think sometimes you open up the opportunity for maybe not interpreting something correctly that's on their website. But for the most part, we've had very good luck with that as well. Now, as far as how to sign up for Medicare Part D, so again, you want to go through the thought process. Once you decide you're going to go the route of getting original Medicare, A and B, then you're going to want to get that Part D program. So, and again, with Medicare Advantage, almost all the time, prescription drug coverage is wrapped into that policy. So it's a little less cumbersome in that respect. So what you want to do is, unfortunately with Medicare Part D, you got to go to the private insurance market to get policies. And there are hundreds of policies that are available. So it can get a little bit overwhelming. It's not like it's Medicare A and B are the same for everybody. Medicare D, while there are certain parts of the policy that are the same across the board, the details of them are completely different. Your formulary, the drugs that are going to be covered are going to be different. So you got to really spend some time on this area. And unfortunately, there's just hundreds of policies you can go through with it. So the average cost on Medicare Part D, I would say, I always set the expectation of around $40 to $50 a month. I would say half the time it ends up being less than that, but that's a good way to start thinking about how much Medicare Part D will cost you. And then you can go through Part D from private insurance companies. You can go right to their website and get information on it. You can go to Medicare.gov and get information there as well on the plans that are available. And it's a pretty good website. The Medicare.gov website actually is very good as far as getting information from. And I think you'll find a wealth of information there. And I wouldn't hesitate to have anybody go on there and take a look at their website because while it's a confusing topic, they actually do a pretty good job outlining this. And Medicare does they do a booklet every year, I think it's called Medicare View. And it's about maybe an 80-page document that is actually really well written and pretty clear and easy to follow. So, I mean, I recommend that as well, just to kind of inform yourself about what you're getting into. And they do a pretty good job with it. Now, as far as this part with Medicare and private insurance, we'll talk a little bit about how they interact a little bit further. The first thing is that this comes from the Kaiser Family Foundation. They do a lot of research on medical information. What's really interesting about this is that this data is actually from 2010, and they just updated 2011. So that's how much of a gap there is between the information that they're able to obtain and put this together. But I still think it's helpful to understand kind of the breakdown on medical costs. So the way you want to look at this pie chart is that what they're saying is that of the overall medical costs you're going to have, about 42% will be related to premiums and 58% are tied to services. And what are the services? Well, those are broken up right here between long-term care facilities, medical providers and supplies, prescription drugs. Just kind of a helpful breakdown. Again, it's all the averages. So, and again, it's from 2010, so you can definitely inflate this by several percentage points. But the breakdown is the most important part. The breakdown has barely changed between 2010 and 2011's data. It's very small. Now, as far as the out-of-pocket costs that you're still going to be responsible for, so with premiums, you're going to have a Part B premium to pay that goes directly to Medicare. You could have, you will have Medicare Part D if you sign up for that. You're going to have a premium for that. Most of the time, you're not going to have a premium for Part A. And then if you go the route of a Medicare Advantage plan, you also have a premium for that. Although with Medicare Advantage, there are a lot of companies, insurance companies, that have really high deductible plans with no premium. So again, if you're healthy and you want to take a chance at getting a policy like that, you can go down that road. But again, you're going to have a really high deductible, so you just have to analyze that and see what's going to make the most sense for you. Now, as far as other out-of-pocket costs goes, with Medicare B, you've got deductibles you're going to have to pay. There's going to be things that just aren't totally covered. So the plan is you got to think about what's the best way to structure this program for you. Now, as far as the monthly premiums go, I'll just touch on this very briefly. With Part A, it's going to be mostly, for everybody, it'll be $0 if you paid in the Social Security greater than 40 quarters or 10 years. If you haven't, then there will be some costs that could apply to you. Now, with Medicare B, for someone starting in 2016, the base premium is $121.80. If you already have Medicare, going into this year, it's $104.90. But starting this year, that's what the cost is. There's also what's called an income-related adjustment. I'm going to cover that, and I think it's the next slide, and what that means. Now, with Part D, again, it varies with the plan. I always set that expectation of $40 to $50 a month. And there's also an income adjustment related to that, which we'll cover in just a second. Highlights what that income adjustment is. So what am I talking about with that? So about probably been about 5 or 6 years now that this started. What the IRS or what Medicare is saying is that the more money you make, you're going to pay a higher Medicare Part B premium. So the way you want to read this, and I realize there's a lot of numbers here, and I'll step away in just a second. I just want to make sure I'm being clear on what I'm showing. This is based upon a single filer on a tax return. This is for joint filing on a tax return. So the columns represent the same information, just it depends on your filing status. The way MAGI stands for Modified Adjusted Gross Income, so if you look at your tax return, Modified Adjusted Gross Income, for the most part, is going to be your income that shows up on your tax return. There are a few items that you can reduce your income from, but for the most part, it's your income on your tax return. So I do have the married filing separately status here as well. What this is saying is that, let's just look at joint, for example. If your modified AGI is less than $170,000, then there's no income adjustment for you. So that base premium of $121.80 will apply. Now, what will happen next is that if your income is in a higher level, then you're going to have an additional premium to pay. That is covered in this column. So somebody that falls into this income range is going to pay $121.8 plus $48.70 for the monthly premium. And then the income levels, as they go up, the premium adjustment goes up as well. It's to the point where you'll pay about 3 times more if you're at the highest level of income. Now, what's being talked about is possibly expanding these income ranges and lowering these so that a lot of people are going to pay the income adjustment. That hasn't happened yet, but it's being talked about pretty seriously as a way to shore up the Medicare system even further. So that's how that part works. Then, for Part D, prescription drug coverage, I put in $40 a month as kind of a baseline based on the averages. And then there's also an income adjustment as well. Same income levels, the modified AGI levels from before, but you have different dollar amounts. So it's $12.70 for that first bump up, all the way down to $72.90 for the last bump up. And again, we're talking about expanding the range of incomes here as well. And then I just put here in the very final column what the total are for the various scenarios. So it can be a pretty wide range from $144.90 to $446.50 a month. So what that leads into is that if you fall in any of those ranges from year to year, you want to really be thinking about tax planning. And the other part, let me go back one slide on that one page here. The part that's really confusing about this is that if you're doing any tax planning surrounding this, if you want to try to tweak your AGI, modified AGI levels, is that for 2016's premium, they're using your 2014 tax return. They're not using your 2015 tax return because that's the tax. There's still returns that have to be filed. So there's a 2-year gap between what they use for income to determine how much you're going to pay. Just something to keep in the back of your mind. Now for deductibles, let's talk about what you're actually going to be responsible for here. So for Part A, the deductible is $1,288. These are 2016 numbers. Part B is $166 per year. Part D, prescription drug coverage, is $360 per year. Co-insurance for Part A, you can see for hospital stays, again, these are 2016 numbers. You have $322 a day for days 61 to 90 for a stay in a hospital. Then it goes up to $644 a day for days 91 to 150. Just before we go any further on this, with Medigap, those policies are meant to help cover some of these gaps that I'm talking about here. Skilled nursing, $161 a day for days 21 through 100. And for Medicare B, basically it's 20% of the Medicare approved rate is the main thing you want to focus on. Now, as far as Part D coinsurance, as if this stuff isn't confusing enough, Part D is really confusing when you deal with this part of it. If anybody's ever heard of what's called the donut hole as it relates to Medicare Part D, we'll talk a little bit about that here. That's getting phased out, by the way. But let's start from the top. So the annual deductible for Part D is $360. Then you have what they call an initial coverage limit. So Part D is going to pay 75% of cost up to $3,310, and you're responsible for 25% of it. And the number is $827.50. Then you go into the infamous, what they call the donut hole. So that starts when the total costs that have been incurred get to that $3,310 level. At that point, Part D doesn't pay $1 for that. They don't pay anything when you're in this coverage hole, or this donut hole, excuse me. Then you're responsible, as you can see here, for 45% of brand name drugs, 65% of covered generic drugs. You're going to be responsible for that 100% until you get to the beginning of catastrophic coverage, which is at $4,850. So you're responsible from $3,310 to $4,850. That's the donut hole. Now that's getting phased out between, I think, 2020, but it's still something you have to consider right now. And then at that point, Medicare picks up, or Part D will pick up 95% of the cost. So it becomes much more palatable at that point, but you've incurred a lot of money to get to that point. So what does Medicare cover? They cover 100% of hospital stays for the first 60 days, medical services, some preventive services as well. And I got some of this information off the Medicare and You Guide from 2015. And again, that's a really good guide to reference. So what does it not cover? Long-term care, care delivered outside the U.S. So if you do a lot of traveling, Medicare is not going to help you in that case. Dental, vision, hearing aids, cosmetic surgery. Now, before we get into it any further, the Medicare Advantage plans that I talked about, that kind of second route you can go to get coverage, they actually will cover a lot of these things like dental, vision, maybe hearing aids as well. So again, it's one policy that wraps up Medicare A, B, and D, but there also are some other coverages that can be provided there as well. But there's some problems with Medicare Advantage plans that I'll cover shortly, at least things you should be aware of. So what private insurance may cover in full or in part? So again, when you're dealing with this, it might cover the deductibles we're talking about that you're going to be responsible for unless you have a policy to help cover that. It might cover some of the prescription drugs, maybe that $360 deductible I mentioned before. The policies might cover that as well. Now with these Medigap policies, you have to go to the private insurance market to get these as well. They are standardized for the most part, but you still have to go to private insurance companies to get them. You can't go directly to the government for these programs. And again, that supplements Medicare A and B on that kind of first part on that one slide. That's where that fits in. So to make this even better for Medigap is that they do standardize the various policies that are available, but the cost can be all over the place. So you want to go out and shop this out and try to get as many quotes as you can once you figure out which one you want to obtain. And I have a slide that breaks up the different plans that are available. So one area you want to keep in mind from that one of the first slides, you have Medicare A, B, D, and Medigap on the one side, Medicare Advantage plans on the other. You don't want to have a Medigap policy and a Medicare Advantage plan. That they will not work together at all. So you don't want to do that. You're going to pay double the premium for really no additional coverage as well. And actually the insurance companies are not allowed to even sell you those policies together. They can get in a lot of trouble if they do that because it's such a confusing area. So they're not even allowed to do that. They need to check with you and see which route you're going, the original Medicare route or the Medicare Advantage plan. Just to make this even more confusing, anybody who's looked into this at all probably knows this page very well. This lists out all of the Medigap plans. So they're listed by letter, and I do know my alphabet, and there are some that are skipped because they're old plans that have been retired. They no longer exist. That's why you see a jump as you kind of move your way down the screen. So I'm not going to read through the entire page for this, but I want to give you an idea of what this all is trying to say. So over here are the various benefits that will apply, and then you're just going to fill in the grid and build out a policy that makes the most sense for you. So if it has 100%, that means it covers 100% of that cost. If it's 75 or 50, that plan will cover that particular coverage for 50 or 75% of the cost. If there's nothing in the box, it's not covered at all with that plan. So this allows you as the insured to shop around and figure out what's going to make the most sense. Maybe you don't need all these coverages. If you look at Plan F, it's the most extensive one available. It has basically all of the different Medigap benefits, all at 100%, except for a foreign travel emergency, where it's going to cover 80%. So I mean, that's an area where, like, for a lot of our clients, they have no interest in doing any foreign travel. So if that's the case, maybe you don't want to get one of these plans that has some coverage, because if you take that off, you're going to have a lower premium, all things equal. So you want to go through each one of these and try to build a plan that seems to make the most sense for you. Like the Medicare B deductible that we had covered before, these plans, Plan F and C, will cover 100% of that deductible. So if you want to have a little more budgeting ability and cost certainty with this whole program, you can get a Medigap policy that will cover these various deductibles that exist. And then from a budgeting standpoint, you have to pay so much for your Medigap policy, so much for Part B, maybe Part D, and then you have a little more kind of cost certainty with it. So you can go that route, or you can say, well, maybe I won't get one of these plans that covers the Medicare B deductible, and I'll just take that risk on, if you will, in terms of how much I'll have to pay for it. So that's the best thing you can really do with this, is go through and build this out, coordinate it with your other coverages, and make the decisions as far as what you want to be exposed to or not. Get quotes and make that kind of an analysis and see if it's worth it or not. When I tell clients about the cost for like a Plan F that has the most coverage, I usually tell them to plan on paying about $300 to $400 a month for it. But again, the costs are all over the board, so you want to get those quoted out. Whenever we're doing longer term projections for clients, that's usually the number I use to start with. Most of the time it does come in lower, but that's a pretty good number to work from, at least initially think about how much these plans can cost. Now, for Medicare Advantage plans, a couple of things I wanted to mention here is that a lot of this we've already covered. So we talked about the ability to might cover vision and dental. A lot of them do. A lot of them have gym memberships tied to them, and they're pretty attractive policies in terms of what they're able to provide. They're a little easier to get your hands around because you're buying one policy, but you got to go to the private market to get the policy, and you got to get multiple quotes for it. And the one issue you want to think about between Medicare and Medicare Advantage. With Medicare, if you do a lot of traveling within the United States, you have family all over the place, you just do a lot of traveling, Medicare-approved doctors are going to be all over our country. So you can, if you're traveling, you're probably going to be able to find somebody if you need to use your policy for. Medicare Advantage plans, because they're more like traditional insurance, PPO, HMO type coverage, unless you're with a national carrier, you might have some geographic limitations that you're tied to. So with the Medicare Advantage plan, you want to think about that, is that you might be limited in terms of your coverage area. Now, if you go the route of like a Highmark, you might not have, in terms of a Blue Cross Blue Shield type carrier, I should say, you have more nationwide coverage. So that might not be as much of an issue, but before you go down this road, you want to think about that issue right up front. Because I think the Medicare Advantage plans sound attractive because you're kind of wrapping everything into one policy and it's a little less confusing. But that's the big issue that you want to keep in mind is what's your coverage area for that. So otherwise, it works like the insurance you're typically used to most of the time with the PPO, HMO type of a program. See if there's anything else here I want to talk about as far as shopping for the policies. I think we've covered most of this. The drug plan, they're all over the board. And yeah, the Medicare Advantage plans. Really, when it comes to Medicare D, Medicare Advantage plans, shop them out. Try to get your best policy. And the Medigap plans, shop those out because you're going to have a wide range of premiums with the companies. But when I was showing you that chart with like Plan F and A, B, C, and D, that'll be the same. The coverage that they cover are the same no matter where you go. It's just the premium dollars are going to be what's different by insurance companies. Just a couple other things I'll share with you. Just some more information in terms of just statistics and information about medical coverages and how much things cost these days. So this breakdown breaks things down by age, from men to women, and it breaks it down by premiums, which is in the orange, and the services are in the blue. So what you can see is, we'll just focus on this part as you get older, you can see that the services start out being the highest part, and there's actually a little bit of a drop off from age 65 to 74, but then it starts to go up pretty high at that point. Where the premiums jump up initially, but they kind of stay pretty stable over time as well, based upon your age. So it just gives some information again in terms of what your expectations should be in terms of annual cost. So when you get up to age 85 plus, you're probably going to be spending in today's dollars almost $8,200 in overall cost between premium and services themselves. So a typical Medicare budget. This is a lot of what we'll do for our clients when we're building out projections for them. We'll talk about Medicare Part B. To get the base premium of $121.80. The Medigap Plan F, which I have 200 in there. Again, it depends on what the client situation is. We might go up to as high as $300. The Medigap or the Medicare Part D for the drug plan, $40. So your monthly amount just in premiums could be as much as $361.80.
Per person.
Per person, that's correct. So if you have a husband and wife, you're going to double these numbers that we're going through. Now on the overall cost, so you take the premium number from the prior page of $361 a month times 12 for an annual amount of $4,341.60. And these are just some averages that are quoted in a number of different studies. Prescription drug coverage for out-of-pocket costs, budgeting $800 makes sense. Again, an annual number per person. Dental out-of-pocket $300, vision out-of-pocket $300, and just other care type services out of pocket of $200. So you're almost at $6,000 pretty easily every year based upon the averages. So, and again, medical inflation is a whole other issue. The Medicare premiums used to go up about 10 to 15% a year. That has slowed down a little bit over the last 5 to 7 years, but there's a whole different inflation rate you have to consider with this stuff. And for medical costs, we're building out projections for our clients. We're anywhere between 6 and 9 and 10% whenever we're doing this. It's just such an uncertain environment. You have to really plan for kind of the worst case scenarios. As far as this page goes, what can cause your healthcare budget to change in the future? So if you're increasing your costs from premiums, if you're having more medical issues, You might be switching your Medigap plans. You're allowed to switch these plans once a year. So your costs can change based upon what your needs are. You're changed in health status. You might have more expensive drugs you're going to go through. Maybe services that aren't covered by the insurance. Again, dental, vision, hearing, not covered through the original Medicare program. It is covered by Medicare Advantage. These are just the trade-offs you have to go through when you're building out this insurance program. Some other just different studies that are out there in terms of costs. So Fidelity did a study on the amount you need today at the start of retirement to pay for future medical expenses, and it doesn't account long-term care, a stay in a skilled nursing facility, assisted living, whatever the case is. They say you gotta have $220,000 in today's dollars at the beginning. That's a very intimidating number. Now, the Employee Benefit Research Institute came up with a study, and they came up with $271,000 for couples. And then you can see the breakdown for men and women. And then I just put at the bottom your own customized analysis, because at the end of the day, you want to really sit down and try to make a good, solid plan based upon your health history, maybe your family's health history, and based upon what, in terms of your financial situation, what do you think you can cover? Maybe you want to take the route of getting a higher deductible plan with a lower premium. But there's trade-offs with all of this. The nice part about all of this is that we're not going to cover long-term care outside of this slide. But long-term care is not covered by Medicare or Medigap. Skilled nursing care, there's no coverage whatsoever after 100 days in a facility. And as far as help with the activities of daily living, there's really no coverage at all that's going to be provided. So you've got to go the route of looking at long-term care insurance or taking a chance of self-insuring. And the long-term care insurance market has changed a lot over the last 10 years, and it's a problem because less companies are offering policies. A lot of companies have dropped out of that market for a number of reasons, one of them being that everybody's living longer. And when long-term care insurance came into being in around the 80s and into the 90s, they didn't budget for people living as long as they are now. So they're paying more in claims out, which is putting the insurance companies into a bind, financially speaking. The other problem has been is that we've had 0% interest rates, as everybody knows, in their bank account since 2008. It impacts the insurance companies, this low rate environment, because they take your premium dollars and they invest it to hopefully pay out those claims. Well, if everybody's living longer and they're not getting any return on their money, basically, that's why companies are dropping out of the long-term care business entirely. They're honoring their existing contracts, but they're not issuing new ones. So that's a whole other story. That's probably a separate seminar in terms of dealing with that issue, but I think it's an important one to keep in mind when you're going through this, because Medicare doesn't really deal with this at all, nor does the Medicare Advantage plans. So let me stop with that. I know I'm going through a ton of information, and that's why I'm going to have the slides available, because it's so intimidating in terms of the amount of information here. Yes, sir?
Yeah, you see a lot of Americans like moving to Nicaragua and places like that to retire. Does Medicare have any arrangements with these countries at all? So these people are on their own then?
Basically, you are. I mean, you get the Medigap policy that has the foreign travel coverage on there, but I mean, that's not.
These people live abroad.
Right, that's a whole different issue. Yeah. Yes, ma'am. I'm sorry for that.
Your one slide said no coverage for long-term care, and then the Kaiser slide said, showed a percentage for long-term care. Now,
They did,
are
yeah.
you using different terms like skilled nursing versus long-term care?
Yeah, there's a little bit of a play on words.
Is that what it is?
That's all that is.
So in other words, say like if we have an 80-some-year-old lady for birthday, and she goes in for skilled nursing. So Medicare will not pay any, if she, say, lives longer than even after, they only pay up to 100 days, and then she's on her own, even with an Advantage plan, correct?
Yes, even with an advantage.
Now, I know there are trust funds that attorneys will put up, those ones who advertise for long-term care or something. How
Right.
does that work? Do they put it, say like if she sold her condominium or something, and they put that money in a trust fund, and then Medicare pays for, I guess, skilled nursing, and after that, what happens? Does she have to draw out of that trust fund? Is that what?
Yeah, that's dealing this. The question came up in terms of what happens, and this really gets into Medicaid planning, which is different than Medicare. So Medicaid is run by each state. It's kind of overseen by the federal government, but Medicaid planning is where the insurance will be covered if you draw down your assets, basically. at that point. Now, there's various ways you can try to get around some of that by setting up various trusts to sort of shelter assets. It's a very complicated area and one that gets scrutinized pretty heavily because it's ripe for abuse. But in that case, yeah, you're dealing with the drawdown of assets. I think you're allowed to keep your home up to a certain value. I think like a car, if you have like a husband and wife living together, and then you can keep so much in your assets as well. I'm not an attorney in terms of going through all the specifics on it, but there are certain levels of what you're allowed to keep. And then there are trusts you can set up to try to get around the system. But with any kind of a trust where you're trying to get around the Medicaid issue, you're giving up significant control in order to do that. So you have to really be very careful about how you handle that part of the plan.
I always had the impression Medicaid's gonna follow your money no matter where you put it. And I heard
Absolutely.
that they're gonna make you, spend all your assets before they spend their money. That's what I.
Absolutely, that's the general theory behind that. They have what they call a look-back period. It used to be 3 years, where they would look back through your bank statements basically and look where the money went to. That is now at 5 years as far as that look-back period. And if there's anything fishy going on, they'll probably go back further if they need to. But the standard is now a 5-year look-back period as far as how far they're going to trace back your assets. Now, I'm sure that's going to go up over time.
I am employed by a big company, but I'm casual, so I get no benefits whatsoever. So I'm paying out of pocket already for my health insurance policy.
Right.
My birthday comes in May, so I have that paid policy through December.
Yep.
Do I pick up that same policy to cover the space between when I'm eligible to start collecting Medicare?
Mm-hmm.
I mean, I'm legally allowed to do that by law because there's so many loopholes in the law that, you can't do this.
Excuse me. Yep.
Okay, so
You'd want to, in your situation, you probably would want to go the route of signing up for Medicare as soon as you could, and then cover the 3-month gap, do it on that 3rd month to make sure you get the coverage in place. And then, yes, maybe keep that existing policy in place, just to make sure you don't have a gap in case something goes awry.
okay.
And you might have a little bit extra premiums, but I think I'd rather
They'll
safeguard
understand
that.
that, like if I tell them I have coverage till now and I only need it for this long, they will be open to that.
They will work with you on that.
I
But
just worry about
no, your thinking's right though. And those are the kind of things I would talk to the insurance company. I would talk to Medicare. As soon as you can, just to start really planning out the details of that. I think that would be the route to go. But I think that one page I covered at the beginning on those, the enrollment periods would be the one to probably focus on. You should be in really good shape. So, yes. Was there another question over here? I'm sorry. Okay. Yes, ma'am.
I have a couple more years before I can go into Medicare. My husband's turning 65 next
Yep.
month. But I'm employed with insurance,
Yep.
and he's under mine.
Good.
So when's a good time to, I'm gonna be working for another 5 years.
Yeah, in your case, that special enrollment period that I was talking about, that would apply for you and your husband because
Okay.
he's under your plan.
Yeah,
He does not have to go at age 65 and get the policy,
he's self-employed, so
and he's, as a result, is on your plan then.
he's on my plan.
Yeah, so, he's got that ability through you where that special enrollment period will apply.
Okay.
So, that's good from that standpoint, at least in terms of dealing with that late enrollment penalty that'll apply.
Okay.
So you'd be in good shape, he'll be in good shape from that standpoint. Yes?
A question in that situation, if she was to switch her insurance to single with her employer and he go on Medicaid or Medicare, potentially the premium could be cheaper for them together by doing that route instead of keeping him on. Because I'm looking at a family plan here at La Roche and what we're paying in total, and I'm looking at, okay,
Go to Medicare. That's a great point.
And I did that for my husband.
There you go. So that might be something you want to explore. I think it's a really good idea. At least find out how much that coverage would be, how much it would be for the single coverage, and at least make that analysis. I think that's a good idea.
Well, I also have a 24-year-old son on that policy.
Okay. Yep.
And they did tell me if I drop my husband, I have to drop him.
Yeah, that's going to be an issue.
So that's not working.
That is true. They extended that.
24-year-old shouldn't be
Yeah.
covered that much longer anyway, so.
2 more years.
Yeah, as part of the
26.
erased.
Yeah, I can cover him.
But it's an interesting situation. So if you have a child that's on your policy, as part of the Affordable Care Act, they expanded that you're allowed to keep a child on, if they're dependent, to age 26. It used to be 24, and that was only if the insurance company allowed it. Now it is federal law across the board, age 26. So that does add a complication to the situation, which is why in all these things there may be a variable that we're missing in all of this. Talk to the insurance company, because that's a variable that will throw that out because they won't do it. In terms of your husband's coverage.
To sign up for Medicare, what decisions do they need to have made by then?
As far as what to kind of plan for before you go to the Social Security office to sign up for it, I mean, I would have a good handle, just dealing with Medicare, not Social Security, right? As far as that part goes. I would sit down, if you, things you want to do beforehand, I think are deciding on that one slide where you have the decision tree. Do I go the original Medicare route, or do I go the Medicare Advantage route? I think if you decide you're going to go the original Medicare route, then that's when you want to have that part of the decision tree decided. I think you'd want to also shop out the Medicare D coverages. I mean, they're not really going to help you with that when you go. This is just to go sign up for Medicare A and B, just to make sure it's done right. So there's really not too much you have to plan beforehand. I think it's wise to try to plan the whole thing out before, just because it will make more sense to you, I think, when you actually sit down with them. But that's more about making sure you get the enrollment process done correctly. So there's not too much planning you really have to do as far as that part goes at the beginning. Now, Social Security is a whole other issue in terms of benefit planning, but the Medicare part, it's not too complicated from that standpoint as far as setting up that meeting goes. Like I said, I mean, their website's really good. The phone calls when you call in are pretty good. So, I mean, you probably can do those items, especially the website, because you have a little more control on it, but it's just such a big deal. You're dealing with these enrollment penalties, and they stick every year. It's like a 10% penalty that'll you're always going to pay that for the rest of your life. So you don't want to get it wrong the first time through. And if you have employer coverage issues, you want to make sure you're totally coordinated at that point. Yes, sir?
Do you suggest for our employees that are here that have our insurance and they turn 65, but say they're going to work maybe another year, another 6 months, do you suggest that they sign up for Medicare Part A like right away because it's no cost? Do you think we should just go in and sign up for that Part A?
I think that's a safe way to go, unless there's an issue with the employer coverage. And again, I would go to the insurance company first and ask that. So that question being at age 65, if you're working for an employer where you have that special enrollment period that will apply, should you still sign up for Part A because it's probably going to be free? So I think you really want to talk to the insurance company and make sure. I don't see any problems with doing that unless you have a health savings account that you're contributing to. Because as soon as you have a health savings account at age 65 and when you sign up for Medicare A, you can't contribute anymore to it. And that might not be a big deal to you, but that's the only issue I can see where it would really be a problem. Yes?
I did go to the Monroeville Social Security
Okay.
office because I'll be 65
Yeah.
in November. And she told me, are you going to retire at 65? I said, no. And she said, you don't need to sign up. You can wait. I said, I'm planning on retiring after I'm 66, a few months after I'm 66. So I don't really have to do, you don't have to do anything until you're coming close to when you're actually going to retire.
Yeah, the only issue though would be you still want to check with the insurance, your current coverage.
Yeah,
to
I
make
wrote
sure.
that down because
I think that's a smart way to do it.
Yeah.
I think in most cases it's not going to be a big deal, but at the same point it doesn't really hurt to sign up except for the health savings account example. But I would always start with the insurance company. But I would agree probably with what she said. It's probably going to work out to be right in most cases. But I still would check.
Yeah, they didn't tell me to check with my HR, but you did, so I'm going to.
I would definitely do that. There's no question. Yes. Oh. Wow. Nice one.
Yeah, just for the sake of time, I first want to certainly thank Jim for pulling all of this information together. Everyday language. As we mentioned, to help you, both the slides and the video of this presentation will be available to you online. And as soon as we have that set up, we'll let you know where to find all of that. It's complicated. This is the third time I've heard this talk, and I'm saying, but we are repeating this tonight at 6:30, so if you want to come back to this room at 6:30, you can do that. We have some spots in that session. No dinner, but the talk. But Jim's been wonderful, and I certainly appreciate his help and trying to put all this information in one spot. he'll probably stay for a little bit, he has
Yeah,
to
I
get
do have
back to
time.
work.
That's okay, no, I have time even now if anybody has any
If you
questions.
want to talk to him individually, but thank you all for coming. And if we can help you, let's, I don't mean like personal advice.